Yes.
Simplicity and safety. Always look for simplicity and safety. Because Victor Hugo said, La beauté fait la simplicité. La simplicité fait la beauté. So simply, my name is Ghassan Yared. I am an endodontist. Currently, I'm based in Lebanon. I have practiced for more than 20 years in Canada. Then decided to move back to Lebanon, where I am doing charity work. So I have a pro bono practice, and I'm also teaching at St. Joseph University in Beirut. For those who do not know me, actually, I am the inventor of single-file reciprocation, which is the basis of modern reciprocation, like Reciproc and WaveOne.
What do you think about the dental world? Do you enjoy the event and its atmosphere?
I love the event. This is my second time here. It's very, very, very impressive. I really love it.
How does the single-file asymmetrical reciprocation concept improve the efficiency and safety of root canal treatment in complex anatomies?
Well, it makes the procedure much easier and safer compared to what is currently available on the market, because we are eliminating one changing step, which is the scouting with small hand files. And this is the only system where we can eliminate the step in the majority of the canals. So just by doing so, we are simplifying the procedure. And reciprocation de facto is a safer procedure because of the angles that we use, with the instrument when it is cutting dentine.
Given that not all reciprocating systems and motors are the same, what key technical differences should the clinicians consider when selecting their equipment?
That is a very good question. So basically, when we use Reciproc, we should only use motors that were developed for Reciproc. And studies showed that we should only use the motors that have been developed for Reciproc.
With over 400 studies on the Reciproc concept, what scientific evidence do you find most compelling in supporting its clinical reliability and long-term outcomes?
So actually, so far there are more than 1,000 studies on Reciproc, which is unprecedented. There's nothing like that in the history of endodontics. The most important study is a study that has been published very recently, I think last month. It came out from Germany, from the team of Dr. Andreas Bartholz. They did a survival study over 10 years, and they treated more than 14,000 teeth. And they compared in this study three concepts of canal instrumentation. One was hand instrumentation, the other one was multiple file rotary instrumentation, and the third concept was Reciproc, the Reciproc concept. And they showed very clearly that the survival rate with the Reciproc concept is much higher compared to the other concepts. Not only the survival rate, but the need to retreat or the need to do a surgery after a root canal treatment is much lower with the Reciproc concept compared to the other concepts.
What are the main clinical advantages of the cold single cone obturation technique compared to the traditional warm techniques?
Simplicity and safety. This is what I always look for, simplicity and safety.
How do you address the common misconception that filling lateral canals is essential for a successful obturation outcome?
Well, there are many studies that show that lateral canals, so far, no matter what we do, they are still, when there's an infection, they are infected, and there is always debris in the lateral canals. So pushing a filling material in these dirty canals will not really make any difference.
Based on your experience, what criteria should guide the choices of sealer when performing cold single cone obturation for predictable results?
Basically, I use an epoxy resin sealer, and unfortunately, I have to mention the brand because the brands are very important. I use AH+. Why AH+? Because this is considered the gold standard in sealers. The properties of AH+ are excellent, very favorable for a single cone obturation. I mean by that, it doesn't shrink, it is insoluble, and it has shown very good results in many studies. You should not miss Dental World. This is an amazing event. This is my second time here. Organization is great. The quality of the lectures is fantastic. The team behind this is just amazing. So come to the next event, and hopefully I'll be here and I will talk to you about a file that will never fracture no matter what you do. See you then.